I am a certified peer support specialist, which is my life. A certified peer support specialist is a person in long-term recovery from substance use disorder. A peer support specialist is a very special person. This person works side by side with someone who's just like them. They walk shoulder to shoulder, they support, they help navigate, they help change. They point out mostly about recovery capital, what's good in someone's life, not what's wrong with you, what's right with you.
I'm privileged to serve as the Senior Program Director for an organization called Favor Upstate, and we're an RCO, or Recovery Community Organization. Our mission is to ensure that everybody in the upstate of South Carolina has a fighting chance at recovery, and we do that by offering primarily education and recovery support services to the community at large, but most specifically individuals and families that struggle with addiction issues.
My job here at the South Carolina Department of Corrections is I'm a peer support supervisor, and so we've trained 121 peer support specialists through the outside community with the support of DAOTIS and strong collaboration of other vendors, Favor, and they bring the training to us as a week-long program, 46 hours, and what my job, part of that entails, is to assist those peer support specialists to make sure that they receive their continued education credits, because they have to recertify every 2 years.
Welcome everybody to the Peer Echo. As always, excited to have you. We've had evolving partnerships over the years throughout the upstate and throughout the state of South Carolina to, obviously there's a huge need for addiction recovery support because of all the families and individuals that are affected. And one of our evolving partnerships was with MUSC out of Charleston. They approached us about doing an ECHO, which ECHO is an extension for community healthcare outcomes. It's an online learning platform that helps provide continuing education for all sorts of practitioners, healthcare providers, teachers. You know, since peer support is such a growing industry, MUSC sees Favor Upstate as one of the leading RCOs in the state, and so they approached us about doing a ECHO platform for peer recovery specifically.
ECHO sessions really help me because we have 54 peer support specialists in 10 institutions, so it's really hard for me to get to all of them. So they have allowed us to open up the virtual meeting to our peer support specialists.
I never did good with lineal education. So with ECHO, I was able to learn so many things. It's a teach and learn atmosphere. So I have taught on an ECHO, I've presented on an ECHO.
So the ECHO sessions are an hour long, and they're from 12 to 1, so it's real convenient. It's during lunchtime. They provide the first 30 minutes is a case study, to where a peer support specialist can bring a case study about supervision, about their staff or teammates, or about a client specifically. And they read through the different challenges they faced, and along with the treatment plan that they had, and then they open up the floor to any questions and any ideas. And so that peer support specialist, if they still have that individual on their caseload, can go back and kind of think outside the box of more convenient ways or additional ways to help this individual. So that's the first 30 minutes. The second 30 minutes is then about a didactic, so it's an educational topic, whether it be about fentanyl awareness or treatment facility and services. So it's a great mix. And then before and after, of course, we share events, employment, openings, and things of that nature so that we can all support each other.
All right, I think we agreed I would be Terry and you'd be Jim. Well, Jim, I'm glad you're here.
The future really is wide open and it's very bright. I see our partnership with MUSC only growing stronger, and I see peer echoes, or really online continuing education for peers, as a very needed service. So many of the peer support specialists in rural areas or more remote areas don't have access to the supervision and the support like they do at Favor Upstate. So I think the online learning platform for continuing education for them is just priceless.
You know, we can't do anything alone. I mean, you know, I think that if I thought for 1 minute that I can do anything alone in helping someone else, it wouldn't do justice to the person that I'm serving. It just wouldn't. It wouldn't be fair to them. So I think that the impact of all of us networking together, coming from the hospitals or coming from the 301s, the Drug and Alcohol Commissions across the state, when we network, people get better.